Don't go for a COVID test unless you really need one. That's the message from the province today as long lineups continue at many of the 151 assessment centers. As Lisa Hefner reports, Ontario is allocating another $1 billion to COVID-19 testing and contact tracing.
Ontarians are starting to understand that patience is often required for a COVID-19 test.
The girls have brought lots of coloring to do. My son's brought his book. I've got my book. We've got snacks and water. We're ready for anything. We were prepared for this. We've been trying to get a hold of public health, and we do know that they're overwhelmed with calls. So we just thought we need to get our kids back to school. Everybody's starting to feel better. They had a cold, what we think was a cold.
The Premier says there is too much demand from those who don't need the test.
The more hospitals we're talking to, they're saying that close to 70 and sometimes 80% of the cases, people have no symptoms at all. They're anxious, and I understand that. We have to focus on the people that need a test because of their jobs or if they've been around someone that tested positive.
So while those without a valid reason may be turned away from COVID testing for now, the province says capacity will grow.
Our government is investing over $1 billion to dramatically expand our testing capacity. This means more testing locations and more case and contact management.
The Premier says swabs that test for COVID in Ontarians may have to be sent to the U.S. for analysis.
We're utilizing every single testing lab there is in the province, and I'd much rather send it to other provinces if they have the capacity.
Doug Ford is still pushing Health Canada to approve a test that can detect COVID-19 quickly without needing a lab, like this South Korean device currently under consideration. Health officials say the current lab test that takes a sample from high in the nasal cavity is still the most accurate. Pharmacies will offer a less invasive and slightly less effective test for people with no symptoms. Lisa Hefner, CHCH News.